Okay, um, Dr. Fatum Singh, are you ready with your presentation now?
I'm with you. I'm trying to sign into my laptop and I'm restarting the whole system. I'm doing it on my because the way I'm to present is on my system. So I'm logging in on my phone.
Okay,
So
I
please
think
bear with me. So I'm logging in on my phone, but what I'm to present is on my system. So I'm
so.
coming.
Is it possible for you to send your slide? Then let's
That's what I
try.
wanted to do since, and I'll do that.
Please,
I'm
can
doing
you
it
do
now.
that? Can you send to me?
Okay.
Yeah, thank you.
Dr. Fatusin, the record is still showing that you are logged in on 2 devices. You need to log out of one. So I guess that's probably
one. I've logged out from one. Oh.
It's still showing. You are
Hey,
speaking from one. The one showing Oluwatoyin Tireni Oluwafatunsin is still also there. Yes.
I've shut down. I don't know what the problem is.
It's still there. It's still showing you as a participant. Oluwatoyin Tireni Oluwafatunsin. And then there's another one with Oluwatoyin Fatusin. Or you can mute the other one. You can mute it if you are not logged, if you've not logged out successfully, you can mute that.
No, Dr. Fadip, I think I see only one screen of Dr. Fatum Singh. So
there's two names there. There's Oluwatoyin Tireni. There are two participants bearing a name. There's one Oluwatoyin Fatusin. There's a second one, Oluwatoyin Tireni Oluwafatusin. That one just left now.
You still see it?
Yeah,
no, it's
I
gone
think
now.
she signed off. Yeah.
It's gone now.
So,
okay, Doc.
So I've sent you this stuff on WhatsApp. Please quickly check it. Help me share it now, please.
And the echo has gone. I think we are fine.
Yeah, just help me share it because
again.
I was using 2 devices. That's why.
The echo is gone now.
So
I think maybe you could try to share the screen from your end.
Dr. Neil, help me share. No, because I don't know. It's not going. It's not working. So just share it for me, please.
So Dr. Fatum Singh, I suggest you share your presentation with Dr. Aniyo.
I've done that. Please, Dr. Aniyo, see it in your WhatsApp now.
Yeah, Dr. Aniyo will sign in. Yeah, could you please wait for please wait.
I'm sorry, everybody.
I think there is some problem with Dr. Aniyo has left. So we'll just wait for 2 more minutes and then probably you can, Dr. Fatum Singh, you can share the presentation with me. So I will share the screen otherwise.
Do I have your email address?
Yes, I will. We'll just wait for 2 more minutes. No, we'll see if Dr. Aniyo comes back. Yeah.
Let me just share right away with you now.
Yeah, okay. So I'll share my email to you.
Email address.
Yeah. Give me a moment, please.
So, can I get your email address, please?
Yeah, Dr. Fatum Singh, I'm sharing it.
You're giving me?
Yeah. Dr. Fatam Singh, did you get my message? Yeah, Dr. Anayu is back, Dr. Fatam Singh.
Yeah. She said sharing. She's sharing.
Yeah.
Anayu, are you sharing?
Have you sent
sharing now? Yes, check your
by...
WhatsApp. Yes, since I sent it to you. Check your WhatsApp, please.
Yes,
Help me
maybe
share.
you should. Okay. Okay.
I've sent it to you, please. My laptop is taking forever to start up again. Have you seen it since? Okay. Right.
Hello.
Dr. Ravis, I'm sharing it with you now. So
can you see now?
Okay.
Yeah. We see your.
Oh, good. So no need. I was about clicking send. Okay. So good afternoon, everyone. I'm Oluwatoyin Fatunsi. Hey. I'm Oluwatoyin Fatunsi. I see some error. So the title of the work is Assessing the Environmental and Health Impact of Electric Waste Dump Sites on Groundwater Quality in Lagos, Nigeria. And it was a collaborative study, and these are all the people that were involved. Don't mind me, I was drafting it and I left the logo, things I wanted to make sure I put inside. Can we have the next slide? So so this study for this, okay, can we have the next slide, please? Hello, Doc. The next slide, please.
I've tried to send it. I don't know why it's not. Is
You can't change it.
I'm telling you, I can't.
What is happening to our internet today? Okay, let me keep trying. So Dr. Ravi, I'm sharing it with you now.
Yeah, Dr. Fatam.
Please, can you share with Dr. Ravi?
Yeah.
You have it, Dr. Ravi.
Yeah, I'm just waiting. Yeah. Yeah, I got it. Yeah.
Oh, good. Thank you, Dr. Ravi.
Yeah, Dr. Fatam Singh, you please go ahead. Yeah.
I thought I deleted that logo name. Sorry, I don't know why it's showing. Anyway, I'm Oluwatoyin Fatunsi. This is an error which will be corrected. And the study of the work I'm presenting today is assessing the environmental and health impact of electric waste dump sites on groundwater quality in Lagos, Nigeria. Sorry, that logo name is an error from trying to make the poster and the slide. So everybody here, it was a collaboration between some colleagues in Ghana and some people in Nigeria, and that's why you see the name here. So they got the grant and we executed the project. Myself and Olayinka executed the project here in Nigeria. And so we're from the University of Lagos. Can we go to the next slide, please? Next slide, please, Dr. Ravi, next slide. So just for those who have never been to University of Lagos, at least you enjoy the beautiful scene in the University of Lagos. That's our Senate building. We are surrounded by a beautiful lagoon front. So I just felt I should tell everybody, since not everybody is from the University of Lagos, so everybody will see where our lab is and where work was done. Can we go to the next slide, please? And so this is the outline for today's presentation. I'll be starting with introduction about the work and methodology, the results, discussion, and conclusions based on our findings of this study. Can we go to the next slide, please? So I'll start with talking about potentially toxic metals. They are commonly called heavy metals, but the correct name as a chemist is potentially toxic metal. And this, what's the problem associated with them? They are persistent in the environment. They are persistent, that is, they remain in the environment. They don't get degraded. Instead, with time, they will increase in the environment and they get accumulated in the food chain. That is, so we know in the food chain, that is, a small organism, let's say it gets absorbed by plants. Plants eat maybe earthworm eats them, a fish eats the earthworm, and a small fish eats the earthworm, bigger fish eat the smaller fish. And as you go up, we find out that the concentration of this potentially toxic metal, PTM, increase as you go up the food chain. So by that we say they accumulate in the food chain. And these PTMs have been linked to very many diseases, including cancer, some kind of dementia, some different kind of diseases, including cancer. And they have been found in various environmental matrices. But naturally, these potentially toxic metals are not supposed to be in high concentration that will be scary. They're supposed to be in minute, insignificant concentration. But because of the activities of human beings, we're finding these concentrations of PTMs high everywhere. The next slide, please. And one of the places now we know from literature, from people who make electronic waste, that a lot of metals are used. A lot of metals are used. A lot of rare earth elements are used in making these our electronics. In our electronics, you have copper, you have gold, you have all sorts of metals used to make our electronic devices. So now, in Lagos, in Alaba in particular, Alaba is like the headquarters in West Africa, where most of the electronic documents, electronic materials are imported into in Nigeria. So if you want any fairly used television in Nigeria, you'll be thinking of going to Alaba market. If you want fairly used computer, you would think of Computer Village, but finally you think of Alaba market too. So most of the fairly used things are usually imported, and it gets to Alaba, from which they go to other markets. Now, another problem with, so like I said, that most of these electronic wastes contain metals, contain metals that are potentially toxic. And when these electronic wastes when you break them down, because in Alaba, many of the things they import, I would say from paper, literature research, it shows that 50%, if not more, in some of the containers are useless things. So it's only a small quantity of these fairly used things that are really useful. So most times when they come like that, there are people there who break these electronic devices, like our computers, our radios, anything electronic, or television. They break them down to recover the valuable parts, like the copper. The copper is very valuable to them. They are different. Some of your the circuits inside them are very valuable and can be recycled. So you see these people in Alaba breaking down electronics to recover things that they can sell for money. But we know that in Nigeria in particular, especially in Lagos, most of us drink waters from boreholes. Most of us use well waters to do what we want to do for domestic purposes, because we really do not have pipe-borne water. It's only in very few small areas that they have pipe-borne waters. And this is the case of Alaba is not different. So most of the households there use borehole waters, well waters for their everyday need for domestic use, washing of clothes, cooking, even drinking of water. They use waters from the borehole. Even the pure water companies all use borehole water and say they are treating them. So knowing that this electronic waste, this electronic out of use, end of life materials are usually being decomposed, are usually broken down, and they release some of these potentially toxic metals. And we also know that people drink water from groundwater. We decided to see, is there a relationship between, please, can I see the next slide, please? Is there a relationship between these activities? Is it impacting on the groundwater there? And there's been concern in some reviews about the effect of these recycling activities on the environment. And some other people have studied the proximity of dump sites to households, to groundwater in households. But in literature, nobody has really studied the effect of e-waste recycling and the effect on groundwater. So that was the premise for this study. And we know that dump sites also affects the physical-chemical properties of water, groundwater. And so using physical-chemical properties, we can tell whether the dump site is being affected positively or negatively. What are physical-chemical properties? Physical-chemical properties, we can look at it in two forms, physical and chemical properties. So by physical property, we are looking at the pH, the conductivity, taste, color. These are physical. But chemical properties, we are looking at BOD, COD. BOD, we look at that as biological oxygen demand, chemical oxygen demand. We're looking at alkalinity, chloride, and many other things. So by physical chemical properties, we are looking at both the physical and the chemical properties, using it to assess the quality of the water. Please, can we go on to the next slide? So, and using the physical chemical properties, you can do some calculations. You can assess the water. You can determine the water quality index. Water quality index is a kind of indices that tries to add up all the contribution from the various physical chemical parameters. So add up the effect of pH, the effect of its conductivity, the effect of potentially toxic metal, the effect of biological oxygen demand, all the physical chemical parameters. It adds up all the effects and give you just one number. With that number, if the number is high, you say, oh, this water is not good. With the number, if the water is low, you say, okay, this water is still manageable. With that one number, you can say, oh, the water is very good. So that's what the water quality index is. So it's an indices that summarizes all the many physical chemical parameters into one digits that we can handle and use it to estimate the quality of the water, especially with respect to drinking. Heavy metal evaluation index, heavy metal pollution index, these are other indices that helps us. It's just like water quality index, but this one now, it sums up all the various metals, potentially toxic metals in the water, and it forms up in particular manner so that you have just one data. And with that data, you'll be able to say, oh, the potentially toxic metal concentration is very high, and at this level, it can cause problem. At this level, it's not too high, it's manageable. At this level, we need remediation. So these two indices are similar, but not exactly the same. But they both tell us, they both summarize all the various metals into one data that we can use to qualify that water that contains these potentially toxic metal. So other studies, now in literature, there are limited studies on PTM in groundwater near the Olusosun and the Alaba dump sites. And we know that the Alaba dump site is the biggest dump site for e-waste. The Olusosun has a part dedicated to e-waste. Olusosun dump site has a part dedicated to e-waste. Why the Alaba dump site is a massive. In fact, people live there. We visited the site. People live there. People like normal, nothing is going on, but a lot is going on. So we decided to check the risk associated with these activities and the groundwater. What's the risk of taking these waters that these activities has affected? Is there any negative risk to the human beings drinking those water? Is there any risk? People have done some other type of risk. People have done, I saw one paper, people have done something on blood. I saw one paper, people have done something on the dust, but nobody has really considered the groundwater there, and really done a holistic study, calculating the cancer risk. There are other health risks associated. Nobody has really assessed the risk in multi-dimensional approach as done in this paper. Please, can we go to the next slide? Dr. Rivi. So yes, I said previous studies are outdated. They lack PTM indices and other risks like cancer risk, hazard quotient, they lack all those risks. And then most of the previous studies used less sophisticated equipment. They use the AAS and they will say this metal is not detected. This is not there. This is not there. So when you want to do such study, you need a very sophisticated tool with very low limit of detection so that it will detect minute concentrations. And that is why we went for the MPOES. The MPOES is like the ICP-MS, that is the inductive coupled plasma mass spec. So we went for this. This has a very low limit of detection so that you can go really low. So this is the highlight of this one, was be able to assess risk that will have not been determined. Few studies in the past did just very few groundwater. We did extensive groundwater monitoring in the area. And let us see, please, can we go through to the next slide, please? So the aim of this study was to assess the physicochemical quality of the groundwater and the associated human health risks, the risk associated with the consumption of this groundwater that are near this electronic waste dump site. Can we go to the next slide, please? And these are the objectives that we ticked, that we finally achieved. So we broke down this massive aim into small objectives. So the first objective was to assess the physicochemical quality of the water. The next one was to quantify the amount of PTMs, potentially toxic metals, in the groundwater. And then the next, using this data, so we determined the water quality index, the heavy metal evaluation index, the heavy metal pollution index, the hazard quotient, and even the cancer risk. In fact, also ecological risk was also determined. Please, can we go to the next slide? And so this is the methodology. So so this is the methodology. In 2021, the samples, the sites, both the Olusosun dump site and the Alaba dump site were surveyed, and then we were able to identify groundwaters, that is wells and boreholes around the sites. And then we sampled them. We sampled the borehole water and the ground and the well water. Together they are referred to as groundwater. And then we took them to the lab, we carried out analysis and then analyzed the data. This is the map of the places that were studied. You can see the Olusosun dump site area, especially the part close to the e-waste dump site part of it, and the Alaba dump site, wholly devoted to e-waste, were analyzed. And these are just a summary of all the various physicochemical parameters that were monitored. Can we go to the next slide, please? Thank you. We got plenty data. This is just a summary of the data we got. So just because the data were so many, so we just presented the mean and the standard deviations of the results based on the location. So Oregun, Ikosi, Ojota are around the Olusosun dump sites. So we got many groundwaters, like more than 10 for each point. And so the average pH, for the groundwater in that location for the Oregun was around 5, with a standard deviation of 0.4. The average at Ikosi was 6.98. The average at Ojota was 4.69. And then for Alaba, you see it was 6.51. And so we did that because presenting the whole data. But if you go to the paper has been accepted for publication, and any moment from now will be online. When it's online, I will send it to Author 8. But I sent the letter to show that it has been accepted to Dr. Aneyo. So when it's online, there's a supplementary data that has a breakdown of the individual pH for each of these areas, Oregun area, Ikosi area, and the supplementary data, the individual data. So for this pH at Ojota, we had like 10 or 15 individual groundwaters that were monitored, and the average of it was just presented here. And so all these physical-chemical parameters were monitored, were analyzed. pH, oxidation reduction potential, ORP, EC, electrical conductivity, turbidity, DO, salinity, TDS, TS, TSS. TDS is total dissolved solid, total suspended solid, biological oxygen demand, hardness, total alkalinity, acidity, and chloride. Please, can we go to the next slide, please? So all these various, and in the first table, some of the parameters were determined using in situ approach. A Mettler multi-parameter meter was used for some of the parameters like pH, electrical conductivity, total dissolved solid, and oxidation reduction potential. In situ meters were used for those about 4 or 5 parameters. The remaining parameters were determined in the lab. So we some like the T total solid, suspended solid, it was determined gravimetrically. The chloride method, chloride in the water was determined titrimetrically. For the nutrients such as nitrate, phosphate, we use UV spectrophotometer. The technique is called UV spectrophotometry. So for those parameters, we developed colors, and the colors were now we made the color, we put them in the spectrophotometer, and they absorb color. Based on the absorption, the concentration of these nutrients were determined. That is for nitrates and sulfates. Now, for the potentially toxic metals such as cadmium, copper, nickel, lead, zinc, they were digested. We digested them using aqua in the lab under a fume hood, and then took them for analysis on the MPOES, that's the microwave plasma optical emission spectrophotometer, that's the MPOES. So we took them for the analysis. So most of why many people do not use this MPOES is because of cost. The AAS is in many-fold cheaper than the MPOES, but the MPOES is many-fold more sensitive than the AAS. Can we go to the next slide, please? So based on all the physical-chemical parameters and the concentration of the metals, the water quality index was determined. For the water quality index, it's a formula that is usually used. So the first step will be to assign weights to each of these parameters, and then correlate the weight to the standards. So because Nigeria has standards for drinking water so we use the Nigerian standard. In this case, there's a way you relate it to the standard and sum everything up to get the water quality index. Now, so the water quality index, we found out that most of the water were unsuitable for drinking. Only, in fact, no water around the dump site can be said to be of excellent quality. No water around the dump site can be said to be of good quality. The water around the dump site vary from poor water quality to water very unsuitable for drinking, as in very, very bad. So this calls for concern that most of those water that people are using are that for people that live in those environments. It is just a matter of time. It is either extensive treatment must be carried out before they are used for domestic purposes. Can we go to the next slide, please? We also calculated the heavy metal pollution index and the HPI and the HEI. And again, the values were generally very high. Even the ecological risk index also gave high value. In fact, the values recorded here were generally higher than other studies on groundwater within Nigeria and outside Nigeria. They're generally high when compared to other studies. And the result here was similar to a study I found that worked on groundwater near dump sites. Can we go to the next slide, please? So based on this, we decided to calculate the cancer risk and the hazard quotient. Cancer risk, hazard quotient is an indices. It's a multi-parameter kind of calculation. It tries to estimate the danger, the health risk, if somebody drinks that water. It tries to say, is it high, is it low? While the cancer risk tries to estimate that if people take this water, will they have cancer or will they not have cancer? That's what these two risk, these two parameters are for. And the study showed that the hazard quotient for adults, for children are so high, are high. In fact, at this level, urgent intervention needs to be taken. In fact, for children, it shows that the tendency, anything more than one, shows that the tendency for people to have cancer if they take the water is very high. And here you found out that the maximum, see the maximum data, 17833 and 337.17, whereas the minimum for children was 1.07. Means that for children, for every 1,000 children that take it, at least one child will come down with cancer. That's the meaning of this. Why the maximum? So the risk is higher to children. Of course, we know because their body mass is less than adults. But there's still risk associated with children and adults. So this study highlights the dangerous impacts of the recycling activity going on there without any regulation to the nearby environment. Can we go to the next slide, please? I've discussed everything in this discussion. Please, can we go to the next slide? Please, can we go to the next slide? Please, can we go to the next slide? So the water quality index, the HPI, the HEI, and the ERI all show that the water is is very polluted, and all the water there, in fact, should not be used for domestic purposes, especially without proper treatment. Can we go to the next slide? The findings highlight the significant contamination of the groundwater near the dump sites and the potential risk to public health and the environment, emphasizing the need for remediation and monitoring measures, the need for monitoring measures to be put on those recycling activities going on at those dump sites. Thank you very much. Dr. Aneyo, you have the floor.
Yeah, Dr.
Dr. Ravi.
Yeah, Dr. Fatunsin, thank you for your presentation. And I call upon the people, if you have any questions, you can type your message in the chat box, or you can ask, or you can raise your hand.
Yeah, Dr. Ravi, we have the lead reviewer. That's the in person of Dr. Fadikwe.
Okay, so yes, yeah, first we'll, so we'll have the lead reviewer analyzing the paper, and then reading the paper, and then So yes, I invite our reviewer here right now, Doctor. The floor is yours now, right now. So I'll stop the screen.
Thank you very much, Dr. Aneyo. Dr. Fatusin, Dr. Aneyo, for asking me to be a lead reviewer in this paper. Dr. Fatusin, thank you for this beautiful work. We can't overemphasize the importance of this kind of study at this time, especially with the rise of the use of electronic facilities. And of course, we know disposal problem is definitely going to pose a challenge. So I commend you and your team for this kind of work that is done at this time. Thank you very much. So I've looked through the paper, and I have some questions, some of which some of which I'm not sure you really like hammered on in the course of the presentation, or maybe I probably missed it out. So some of it are basically from just being curious about what could have influenced certain things. So I first noticed under your sampling, with respect to the manuscript now, that you did sampling in July 2021. And we know that July period is like the rainy season period in Lagos. And we know that rainfall seasons affect, can affect the concentration of materials in the groundwater, okay? And you sampled boreholes and wells. Wells are generally deeper than boreholes.
Dr. Fadikwe, I was locked out. I didn't get your comments again. I was locked out.
So my first question is relating to the period of the sampling. So I said that period of July is around the rainy season period in Lagos. And we know that season would affect concentrations in terms of water availability in the water table. Because from your work, you did sample boreholes and wells. So, and we know that wells are deeper down there in the water table. So it kind of aroused my curiosity in terms of the way you looked at the data. Do you think maybe seasons could play a factor? Like, for instance, do you think it will probably be worse, these indices, during the rainy season if you sampled the water table around the dry season period? What do you think could be an effect of sampling at rainy season versus dry season? That's number one. Then number two, I wanted to ask about the differences in terms of boreholes versus well. Boreholes are more like not really groundwater like the way wells have. Wells are closer to the water table than the boreholes. So in your analysis, in your study, did you possibly find any differences with respect to boreholes and wells in terms of this water quality indices? Did you get me, Doctor?
Yeah, I'm taking note of your question.
All right, okay. So the question in terms of proximity, I was able to get that. I mean, the sampling sites are quite far apart because, and I was trying to see if, because really, when you look at the water table, if the distance is not so much, we cannot really say that the water is really different. But I saw that the sampling sites are quite far apart. Like if you are driving, it will be almost about 30-something kilometers. So they are quite far apart. So the distance could not play a factor in the values that that you obtained. So which leads me to the next question in the sampling aspect of the paper. So you said you treated the bottle, you soaked it to around 91% nitric acid solution. So I was wondering, was this a kind of sterilization technique? What was the essence of, sterilizing, or I will not use the word sterilization. What was the essence of, maybe doing that treatment? Because I was just curious to know what that treatment had to do with. I'm a biologist, and definitely when we are doing sampling, we try to make sure that we do it aseptically. So I wanted to have an idea of what the treatment did to the bottles that what that treatment meant to the bottles before using them for the sampling. So you understand me, dear?
Yes, I do.
Okay. So the other part that I'm going to go to is sorry. The other part I'm going to go to is I've talked about the rainy dry season comparative study. So like I asked that, do you think maybe if you did a comparative studies, the values, what do you think would possibly happen in terms of that? So I looked at some certain stuff too as well in the conclusion area. Okay. I wanted to ask that, are there any peculiarities in terms of the electronic drum sites? Because basically the areas that you sampled, Oregon, Ikosi, Ojota, and Alaba, right? That's like the area in those local governments, if I'm correct.
Yeah.
So I wanted to find out, are there any peculiarities in terms of those e-wastes? Like in terms of the categorization and possible types, which could maybe be an index to determine, okay, possibly this type of waste is more dealt with and recycled in Ojota. Could it be why the indices are higher, even though they are all bad? But there's relativeness to the badness, like if there's any word like badness. So could it be maybe in terms of the categorization? It would be interesting to know what kind of waste is peculiar to each of those locations, especially in light of the fact that you said, there needs to be regulation in the practices. So the regulations and the types of practices, in terms of regulating the practices of recycling and disposal of those electronic waste in those environments, would be relative to the kind of waste that they have in those places. So which is why I'm kind of like interested in what kind of waste, did we have in those environments. Then you said, according to the WQI classification, only one site had groundwater of good quality. So I wanted to ask you that which of the sites had that good groundwater quality? Is it the Ojota, Ikosi, Alaba, like which of the sites specifically? I don't mind if you could answer that, because my next question is sort of like hinged on that.
So it's just one it's just one well that had
one
good
well
quality.
In which area?
Yes, one let me check. It's just one particular groundwater sample that had based on WQI, based on the water quality index, WQI. But based on other parameters, cannot be said to be really very good. That's why you have to use multi.
I get it. But I was kind of interested that based on the WQI, at least one groundwater. So it kind of aroused my curiosity or interest that, okay, are there any particular differences? Yes, we are talking about the fact that the water is not good. You have to use multi-parameters. But in this particular site where WQI happened to be good, is there anything they are doing differently? Possibly, and I'm not surprised anyway that it is well water. Just like I said, relatively borehole is more of surface than the wells. The wells are kind of always deeper. So do you think maybe there's anything in terms of the practices in that particular area that sort of like made, in terms of observation, that could have made it possible that at least, even though all the other parameters was not fantastic, they had a kind of acceptable WQI index in terms of what do they actually do? How do they do their things a little bit differently from what the other areas that have all the bad indices are doing? That's where the question relating to that is coming from.
It's not, and it's not as if.
I'm listening,
okay.
Doctor.
So that one that you said classified as good per se it was just better, but the average
compared
for that
to the
place
others
was not it was just better, not as if it was good. Because looking at the graph, it was all of them.
That's why I'm interested in knowing, are there any particular practices around that area that is, it might just be slightly different from maybe in a particular area, it's just they are doing it with reckless abandon.
Maybe
could it be that maybe that particular area, they compartmentalize their waste, than the particular other areas, they just do it anyhow? So I'm just interested in knowing what could account for at least that WQI in that area being better compared to the others. We have already established the fact from the work that you've done that the entire water system in those areas are bad. But again, it is all of these kind of micro observations that points the direction towards, effective policies and regulation that tries to solve problem. Because when we try to look at everything just from the big picture, we lose sight of those tiny little things that are important indices. That's where the curiosity in terms of that is coming from.
Okay.
Then,
Doctor, I'm looking. Okay. You said you wanted answer
then the last thing I wanted to say, just interested in that particular area. The last thing I wanted to talk about is the cancer indices. So the CR and HQ results that you looked at, and you said the risk of getting cancer, I think you gave a statistics in one in...
Yes, a value, yes.
One in what? Again,
1,000. 1 in 1,000 children.
1 in 1,000 children in those areas have cancer.
That's based on this calculation.
That's the direct implication of the results. So I wanted to ask you, out of curiosity, how many children in that particular area actually have cancer? I mean, if 1 in 1,000
maybe we have to go to do a further study, go to the hospitals around there, and see the prevalence of tumor first.
Of tumors among children. So that's an area, if a biologist that you are part of us, even though this is going towards the area, that's a gap that we have identified. So in order to correlate this in order to correlate this data that we have gotten to the real life situation, it would be nice to do an assessment of what kind of child, because you should expect that children should be having cancers, tumors in those areas. Now, the same thing for adults. However, I would like to point something out, that cancer itself is an immunologic related disease. Okay, a lot of the times, those abnormal cells in the body, when they start to develop, your immune system, the same way to treat a microbial infection, there are pathways and regulations in the system that detect them. So let's assume that maybe there's really no high incidence of cancer in this area in terms
Dr.
of the
Fadil,
phenotypic. Hello, sir.
Yeah, Dr. Fadil. Sorry to interrupt you. We have to keep in mind of the time also. Could you please, make the point very brief, in case?
Yes. Because I'm trying to
sorry,
close
I'm
up. That was my last question.
It's 1 in 1
that was
million
my last
people.
Question.
Sorry, 1
that
in
was
1
my last
million,
question.
not 1,000.
1 in what?
1 million. 1 in 1 million people.
Yeah, because 1 in 1,000 felt like a very strong
value that 1 in 1 million.
Expect.
I just checked what I wrote. 1 in 1
million.
No
problem. So I get that. So what I wanted to point out is, it's possible that maybe the reason why those children in those places, even though they are so exposed and may not be coming down with tumors and cancers, could be because their immune system are sort of like micro-evolved to be able to attack those kind of things. Because like I was saying in the other question, there's a concept of all the micro things that adds up at the end of the day. So maybe that could be an interesting thing for a biologist amongst us to pursue, to look at the data in terms of the adults, the prevalence of cancers and tumors around those areas, and also and then check for immunologic factors. Some certain indices in their blood will be raised that has to do with driving and taking care of infections. And then that way, maybe we could even study and understand, how environmental factors play a factor in development of diseases like cancer in areas that are polluted, and we can extrapolate from there to other areas in the country. So that was the aspect that I wanted to point out as the last part. That's it. Doctor, thank you very much.
Thank you so much for your excellent review. I'm grateful. You talked about that particular site, and I went back to look at the location. It was northwest compared to all others. Most other groundwater in that area were from southwest part, as in southwest in relation to the dump site. So it might be, maybe the table geologists will be able to tell us more. It might be the direction of the flow of the water, the groundwater. They always have a flow. The groundwater usually have a direction. Probably maybe it's originating from that north side going southwest or something. But I realized that was the only groundwater in an opposite direction to the dump site. All others were more of on another side. Because if you look at it, I wrote the distance and the what do you call it? North southwest. I wrote the there's a word I'm looking for. The positioning,
the distance, average, the positioning in the map, is on the page 3 of
I
the
wrote
paper.
the map to it, not to the dump site, south to the dump site, west. And I found out that particular one that was a bit better was northwest compared.
So that is the Alaba. That's the Alaba place, right?
Yes, the Alaba.
The one
was
we are talking for is in Alaba.
Yes, in Alaba. It was northwest and a bit far from all others. Most other samples were southwest and southeast. Most other samples that we're able to get were southwest, south, and southeast to Alaba dump site. That was the only site that was northwest to Alaba dump site.
So that probably explains why
the uniqueness
as you
of
travel farther from that area,
maybe as you travel downward, southwest, the water is worse or something. That's what it's showing.
Okay, all right. Thank you very much. That's very good. That's a very good one, ma.
So you were talking again about
the other questions, ma'am.
Okay, can I answer the ones you've answered?
Yes, ma'am. I'm done.
So you were talking about regulation. What type of waste? What type of waste do I think is causing all this? Now, again, when they bring this container, literature said Basel Convention has done a lot of work on this e-waste they are bringing to Nigeria. They have turned Nigeria and Ghana to e-waste dump sites. Abroad, they have what they call a responsible producer producing. When you produce, you are responsible from production to end of life. So you must collect the dead electronics and recycle it. Now they found out that the cost of recycling it in a very sustainable manner is very expensive. So they collect it and send it to us and pay people to receive it. So they'll just put a few good ones in a container, big. Only some will be good. The bulk is rubbish. So they want us to recover the useful one in our own soil, because they know in their own soil, they don't want to pollute it. So they want us to recover it in our own soil and then send the valuable for them to use to produce new one. You see what is happening. If you read reports in doing this, we have to read wide about the Basel Convention. Basel Convention got funding to do some work on the e-waste situation in Africa. And I think Professor Oshun something, UI is retired, was the lead of that thing. He did a good work. And the revelation was, you will cry for Nigeria.
This is massive.
So you will cry. So there's really, until we make policies that we should not be importing fairly used electrical equipment. That's the only policy that will help us. Because in the guise of you want to import fairly used, you bring a container, more than 50% are useless. And the so-called 50 that are good are near end of life. So you only use 2 years and they are bad and back to your dump site. So, and meanwhile, the people that brought it have been paid to ship it to our country. So it's unfortunate. So until our government make policies and people agree that we will no longer use second-hand phone, we will no longer buy second-hand computer, we will no longer buy any second-hand equipment. Let us to be buying new things. At least it will take a while before it spoils. It will not spoil within 3 months. And so the dump will not be so high that we need so much recovery. And then a little has been done in the era of policy. I found out that there's a formal recycling center somewhere near that Alaba, but near Alaba, but not necessarily in Alaba. So they use sophisticated equipment to recycle. There should be more of such they should formalize the recycling of this equipment. So until our government is serious about policy. So this again will raise the awareness that government, there's a lot to be done. Please wake up to your responsibility. That is the purpose of this work. And it's being presented. So it's being presented in conferences and places where government agencies and people will hear about it. That's what we are doing.
So, in terms of the waste, so it's mostly computers and used phones that are in this area.
Electronics, even TV. We found TVs. Set. You know, people are going for flat screen. They are throwing away their old. They are throwing away their old box TVs and also. So any kind, there's no kind of electronics we didn't see. I went there myself with my team.
All over the sites, all over all those sites.
It's a big dump site. Yeah, people live there. They sometimes burn to recover these things. In fact, it's multifaceted.
This is
so. Now you're talking about raining or dry season.
Yes, the effect of the season. Maybe it's going to be worse.
Groundwater. When we say groundwater, people don't use if water used for good useful purpose, domestic purposes. People don't use the surface stable water. They have
I know,
but
I'm just saying that. I'm saying that relative to well and borehole. Borehole is small on the surface. Well is deeper.
Deep. No,
borehole is a little bit. Yeah, I know some boreholes are deep based on the area, but I'm comparing boreholes and wells in terms of access to the water table. So the wells are more like down. No. Sometimes the
wells are super surface, more surface than boreholes. Most boreholes are deep. Most boreholes are deeper than wells.
So did you find any significant differences between boreholes and wells?
Both of them, to chemists, as a chemist, both of them are called groundwater. And so we're more interested in groundwater. Are they present? So I didn't do that statistic. Except I will do more work on that. I didn't do that.
It would be interesting to find out if there might be a difference between boreholes and wells.
And most of the wells were closed, were not open. So from time to time, they open to take and close it. It was not open because of the environment they know they are in.
They were not open well. The problem is the pollution is already getting inside there, whether they close it or not.
Yeah, so it's from precipitation down through the well. It's percolating down through the soil, down to the groundwater.
Yeah, sorry to interrupt. Yeah, so Dr. Fadip and Dr. Fatma Singh, so if you could, briefly, we can move on to the audience questions also.
So we'll stop there. Another person should talk.
Yes. So I think audience also will have lots of questions. So it will be good, to attend to them also. So thank you very much, Dr. Fadip, for that nice review. And in fact, you have covered a lot of, interesting parts in the study. So I also thank Dr. Fatma Singh for her great work on water quality index. So I see here a couple of hands. Dr. Salisu, could you? Yeah. So would you like to ask directly or?
Yes, I wouldn't want to. Thank you so much.
Yes,
I wouldn't want to take.
Yeah, please go ahead. Yeah.
Time has really gone, and I will not want to take your time. But I must say this is an eye opener to us. The climate action people in the house and for not only in Alaba. This thing has been going on and on in different parts of Nigeria. and then it has to be something that has to be, I mean, I just wish you could have another session for this kind of work, because there's so much to add up for others to take up on the gap that is connected to the risk of cancer now, which is what Dr. Fadipe has been doing. So thank you so much, and I really thank you for the opportunity. Thank you so much. Well done.
Yeah, Dr. Halimat. So yeah, Halimat, I think.
Yeah. Thank you very much. Good day, everyone. Thank you, Dr. Thank you to our wonderful presenter. I think things like this should not be limited for to just scientific discussion. There is need for active government involvement, through dissemination of these findings. I'm sure they will have their emails, or probably during all these climate conferences, like Lagos State Commissioner for Health, so interested in that. We have their office address. Things like this should be disseminated, So for active policy work plan, on it. It's not just about the all these waste coming from outside. The waste that we also produce, in Nigeria too, there is no appropriate waste disposal system like that. I was checking through the Nigerian national something, the national policy, the book document that speaks about waste disposal in Nigeria. I saw something on when I was trying to we had a survey on public awareness on pharmaceutical waste disposal, and shockingly we find that government doesn't have any policy that whoever have these drugs with them is responsible for for their disposal. And that should not be. You should not allow public to decide the fate of the unused drug by themselves. There should be rules. There should be public awareness on how to dispose. A lot of people trash in bin. So we need government intervention, guidance, advocacy. Perhaps people don't even know the danger. So, and this can only be, when you know that this thing is not good for you, you won't do it. And it's only government that can effectively, pass this message. So I want to encourage doctor to please not just limit this finding to this forum, but to find a way of disseminating it to the government. They have their emails, it could be through television interview, anybody can pick it up, active dissemination for appropriate policy on our waste disposal system. Thank you very much.
Yeah, thank you, Dr. Halim. So anyone has any questions? So I also see a couple of questions in the chat box. So before that, Dr. Fathunsen, I have a question. Like, I'm just a little curious. So in your presentation, you have mentioned like potentially toxic metals. So I'm just wondering, because you have actually tested for cadmium, chromium, nickel, and arsenic, which are already toxic metals. So they have been already proven to be quite toxic. Because so I'm just curious, why you have mentioned potentially toxic metals.
As a chemist, I'm a chemist by training. Now, these metals on their own, if human beings did not go to where God put them, where they are, they won't be toxic to us. So usually it's by mining, by using of fossil fuels, we brought them out. We brought them out from where naturally they reside and then made them available to us. And generally, when we initially introduce them, they're not toxic. But when they reach certain levels, they become toxic. And so that's why it's been an argument, and in IUPAC has agreed, which is the international body that governs us as chemists, in naming compounds and classifying compounds. There's been a lot of argument for and against, and we finally decided to call it potentially toxic metal. So if you find articles written by chemists or articles where chemists are involved, most times we call it potentially toxic metals, but people in related fields still call it heavy metals. But IUPAC has agreed that we call it potentially toxic metals. So that is why it's called, because naturally they're not there. It's by our activities we've brought it to the surface. And even when it's at minute concentration, it's not a problem. So it's potentially toxic. Until proven to be at very high concentration, we can now call them toxic metals. So IUPAC has agreed to call them potentially toxic metals.
That's great. Thank you, Dr. Pathinson, for that. So I will also there are a couple of questions in the chat box. One is from Shebe. So they're asking like whether did you communicate your findings in popular articles or probably in press. So they're interested to know whether you have communicated it to the public. Yeah.
The paper has been accepted, just been accepted for publication. So in the next few days, it should be published online. Okay. So that is going to be disseminated. People are going to know about it. Number two, there's a conference slated for next week where these findings will be made known. And somebody has advised that we should write maybe a policy brief or something to government. So going forward, when I come back from the conference next week, I'll write a policy brief and drop it with Lagos State Ministry of Environment. Whatever they do with it, it's there, but I'll do a policy brief based on our findings and drop it with them for them to take it up from there. So probably there should be rules and regulations. I think it's not just Lagos, it has to be a Nigerian policy on importing, on how we throw away our waste. So Olusosun has more of waste that we Nigerians use, while Alaba has more of waste, imported waste. So that's the situation. So that's what I will do. So these are steps. So number one, I've published, but in the next few days, maybe when it's published, I'll drop the paper, or it has been accepted for publication. So in the next few days, it should be out properly. I'll drop the paper on the platform. I'm going for a conference from Sunday, this Sunday, it will be shared. The third step will be to write a policy brief and drop it with Lagos State Ministry of Environment and Federal Ministry of Environment. So I hope they do something about it, but I will do my part. So yes, thank you very much.
Great, thank you. So there's another question from Enyonam. So I think she's asking like whether there has been any document or any record like about people's practices of the water. I guess I understand. What I understand is like why is the quality affected? Whether the quality of the water bodies are affected in these areas due to people's practices, like for example, waste disposal or probably over utilization of water resources, groundwater resources. Yeah. So Dr. Pathinson, over to you.
So generally, if you go to these sites, the people are breaking this electronic waste on the normal surface, on the floor. They are breaking it. They are taking what they want. They are throwing it on the dump sites. They are in that area. So they are recycling shops and they are all around the dump sites. They are breaking it. They are smashing the screen of the glasses are just smashed and thrown on the dump sites. The valuables are taken. So now when they dump all the things they don't want, in breaking it, there's dust, there's everything released on the surface there. When rain falls, we know that rain washes things down. Nutrient things go down. So not just nutrient, that's the mechanism we've proposed as to what is causing the groundwater pollution. So it goes down, and because There are other studies of groundwaters in Lagos, like groundwaters from the University of Lagos, and they were not, in my discussion in the paper, they were not as polluted as those ones near those e-waste dump sites. And in fact, the e-waste dump sites were higher than even other dump sites. So other dump sites are high. E-waste dump sites is even higher for these potentially toxic metals. It shows that something is happening with these dump sites. So yes, the practices is obviously affecting it. I discussed that in the paper because I compared readings of other studies for people that are away from, that did similar studies that were not near dump sites in Lagos too. And we found out that their data were far better than what we got. And then most of the previous studies did not even study for arsenic, but we're able to look at that. No, did we do arsenic? No, I'm not sure. Sorry. I'm saying something else. No, we didn't. We didn't. Wanted to, but we couldn't. Okay. All right.
All right. Okay. Thank you, Dr. Fatun Singh. So, finally, anyone has any questions? Otherwise, we can end the session. Yeah.
Published in Chemistry Africa, a Springer journal. Chemistry Africa. It's being published in Chemistry Africa.
Okay. Okay. Thanks for the information. Yeah. So I'll go through that. Yes. So I think if they, if the floor has the audience doesn't have any questions, then we can end the session. I should thank Dr. Fatun Singh for her nice presentation, such a great presentation, and a nice work of especially such elaborate work of water quality index of the area. So yeah, I also thank Dr. Fadib for her nice review and such a elaborate, and she in fact asked a very relevant questions, and it's very nice of her. So yeah, thank you all for attending the session here. So I hand over the session right now to Dr. Aniyo to conclude it.
Yes, thank you very much, Dr. Rafi, for coordinating this session. Dr. Fadipe, thank you for your comprehensive review. And Dr. Fatun Singh, I'm so grateful for enlightening us about your article. We are so grateful. So, thank you very much. Bye.
Okay, bye.
There's still some people are talking on the chats. People are saying things on the chat.
Yeah, I think it's fine. Yeah, they're just, yeah.
Yes, it is, but it will be less. These concentrations we have mentioned will be less in wet season and more in dry season, because dry season the water is more concentrated.
So if anyone has any questions, they can contact Dr. Fatun Singh, through her. Yeah. So that will be good.
All right, thank you, Dr. Ravi.
Thank you, Dr. Fatun. Thank you, and thank you all. Thank you, Dr. Neo. Thank you, Dr. Fadi.
Bye.
Thank you. Bye. Bye.